And as we just heard from Molly as well as Jamie, the president sees a consensus around the need for health care reform. But Republican congressmen, as we know, are singing a different tune. So is significant movement towards reform in Washington real, or is this just political as usual? Joining us now, Doug Heye, who served as communications director for former Maryland Lieutenant Governor Michael Steele and North Carolina Senator Richard Burr. And then we have Doug Schoen, a Democratic pollster and a Fox News contributor. Gentlemen, thanks for joining us. I feel we've got D&D here. We could do a commercial, Doug and Doug. Look, Doug, let me begin with you, Doug Heye. This whole thing talks about a general consensus. The president talking about it, former Republicans like Bill Frist, and then we've got Bob Dole, the former majority leader as well, saying the Republican Party is turning into a party that should just say no, and they should stop doing that and actually support the president. What say you about the Republican plan?
Well, yeah, when I worked on the Hill in the House and in the Senate, whatever boss I was working for at the time would have a bill, my first question would be, where's the Democrat? Because when you have a Democrat on the bill and you're a Republican, that makes it bipartisan. This is a great talking point for Barack Obama. There's no question about it when you can say that Bill Frist supports your plan or Bob Dole supports your plan. The problem is it doesn't really translate into any votes in the House or any votes in the Senate. The president's really talking about a consensus, but the question is, does he have a majority? Right now, he doesn't.
Yeah, Doug Schoen, he's right about that because generally you have good talking points here, but those congressional Republicans are not saddling up and basically supporting the president's plan. They are arguing against it. What do Democrats need to do to bring Republicans to the table to get that kind of bipartisan support that is so necessary?
Well, first, Kelly, this is all a process. I think the Baucus bill in the Senate Finance Committee is a step in the right way, especially with the CBO scoring showing that it will save $81 billion over 10 years. Olympia Snowe, the Republican senator from Maine, has said she's considering supporting it. So first unifying the Democrats, trying to get Olympia Snowe, and then coming up with a consensus that will cover the uninsured, offer insurance reform, and basically offer the kind of eliminations of fraud, waste, and abuse that the president has already spoken of. That's a step in the right direction.
All right, you said something right there, Doug, that I got to really address. You're talking about unifying the Democrats. Right. Why is that necessary? You mean to tell me that the president is not getting support from within his own party?
Well, what we have, Kelly, is 5 separate bills. We go from public option that Nancy Pelosi and many House Democrats say is essential to Baucus's bill, which doesn't include it, has an insurance exchange or co-ops, depending on how it's cast. So we don't have Democratic consensus yet. And to answer your first question again, there will be no legislation unless the Democratic Party unifies behind a piece of legislation.
Doug, I want to get the last word. I want you to get the last word in here real quickly. I'm going to ask you this quick question. We understand now that the United States Surgeon Generals, the former ones of Republican and Democrat administrations, have all signed on board to a health care plan, basically stating meaningful reform is vital to improving the health of our nation. Having said that, why can't there be some bipartisan support to get this measure passed?
I think everybody would agree, and I hate to agree with Doug Schoen, but I usually do, that bipartisanship is what's really needed here. Eric Cantor, the House Minority Whip, made a big push for bipartisanship with Steny Hoyer, and really it was one hand outstretched that wasn't received. But the fundamental point comes down to Democrats, and you have blue dogs who won't support a bill with a public option. You have liberal Democrats who won't support a bill that doesn't have a public option. It's a real pickle that they're in.
Gentlemen, we thank you both, Doug and Doug, today.
And we can both agree with that.
We should take this on the road.
And you agree with that. That's right. Let's do it. Take care.
Thank you.
Jamie.
Thank you.